So we are here with Director of Public Health, Dr. Nate Horwitz-Willis. Hi, Dr. Nate. How are you?
I'm good. How you doing?
And you were nice enough to try to explain to me some of what's going on with the fog regulations, and maybe you could talk a little bit about that and some of the notices that have gone out to a number of businesses in town.
Absolutely. So here in the town of Plymouth, we've been focused on creating a comprehensive fats, oils, and grease program that is also coupled with the Board of Health's regulatory scope for the fats, oils, and greases. And really ever since about late October all the way to December, we've been sending out notices to roughly 428 facilities that handle or prepare food that should have some form of a grease trap. And what we've been doing is we've been working with a lot of these facilities to understand their role in having a fats, oils, and grease trap, so that way we can have a healthy sewer system and also healthy waterways. Because what happens is that if you don't know that you have a grease trap, or if you don't know how to go about getting it clean, it can lead to other ill effects that can impact the public's health. So for example, individuals may flush down their grease into the sink, or they don't clean out their grease trap, and it could lead to some inefficiencies in the sewer system, and it could lead to a grease clog that could also grow to be what's known as a fatberg. And this clog could have pathogens or the types of disease-causing agents in them, and it could lead to a small breakout and have some waste and disease go into places such as our streets or into our waterways, and we don't want to see that happen. And
this, sorry to interrupt, but you mean the actual pipe would break from this pressure within the pipe, correct?
Correct.
The fat berg in the pipe.
Correct, and that's from individuals not maintaining their grease traps, or if they're flushing the grease down into the system. And that leads to our town working harder to try to mitigate those issues to make sure we can still have a healthy sewer system. But we're really in the business of working with people, not playing a game of gotcha. We don't want to fine people. We want to get people to be compliant and also work with us. And if they can't maintain their grease trap, or if they don't understand it, or if they don't think that they need to have it, they can come and talk with me, so that way we can go before the Board of Health to request a variance from the Board of Health fats, oils, and grease regulations. This is all about working with each other.